crisp analyze of a contentious research that suggested workout and mental treatment for human beings in persistent tiredness symptom, suggests their effect is more than humble rather than at first mind. The STEP test found the treatments to be reasonably efficient, guideline to restoration in a 5 of patients. The authors of the unique test in 2007 told they stood by their received information. How randomized test was intended to inspect the efficiency of graduated workout treatment, receive, and cognition behavioral treatment, CBT, for persistent tiredness symptom, CFS, as well named as myalgic encephalomyelitis, or ME. Its received information were favorable, but patient groups love the ME associate include ever been crucial of the way the test was intended and the way the results were informed. Down there has as well been debate above the produce of information of the test, in several disputing it should be done accessible to all researchers for future analyze. While the results were de-examined, following information was derived by a liberty of data query, researchers found how fair 20% of CBT patients and 21% of GET patients superior, on in 10% of monitoring patients. Figures for such who restored were initially informed as 22% for patients in every of the CBT and GET groups, but the diminished to 8% in the newest D-analysis. Written in the magazine BMC Psychological, Conduct writer Dr. Carolyn Wilshire, of the College of Wellington in New Zealand, told the STEP test excited the goalposts by change. The way treat successful was measurable following the test had started. She added, before down there is favorable testimony to propose differently, the finding we must paint is how STEP's treat effects are not supported above the length period, not though on personality report measures. CBT and GET include no length term benefits at all. Patients do fare as so in nice main care thoroughness. The ME associate, that portion funded the new research, told it was no surprise party how spectacular claims for restoration next CBT and GET are not statistically safe. Dr. John Rock, advisor neuroscientist at the West General Clinic in Edinburgh, told superior treatments for persistent tiredness symptom were necessary, or more than efficient forms of rehab. Before we include these, the issue is if it is superior to propose a humbly efficient treat backed by information of lotsome testing, in a lifelike debate of its pros and cons, rather than no at all. The 3 authors of the unique STEP test, Professor Michael Sharp, of the College of Oxford, and Professor Trudy Calder and Dr. Kimberly Jeweller, of Xars School London, told the new analyze had utilized just portion of the information of the test. They as well told lotsome testing and meta-analyses had copied the received information of the STEP test. In finding, we discover slight of material in the criticism and stay by our unique accountable.